Hey everybody, it's Dan with Pain For You, and today's topic is please drop the medical labels. Before I do it, I just want to go through a couple of breaths, not just to relax you, but also to relax me and get into a state for this video. So breathe in the comfort, breathe out the discomfort, breathe in the confidence, breathe out the fear. Sorry about that. My phone's always making noises. I have to put it on silent. So, please drop the medical labels. And, we've been told all sorts of stuff by our doctors: herniated, bulging, spinal stenosis, spondylolisthesis, you name it. That's just the spine, torn rotator cuffs. I don't know. There's a million different diagnoses. We've got trigeminal neuralgia, which is the awful face pain. We've got all sorts of gastrointestinal problems, GERD, this type of reflux, that type of reflux. We've got tendinitis. We've got repetitive strain injuries. We've got, you name it. I mean, there's virtually no end to the number of diagnoses that comes out of the major medical system. And what I will strongly encourage you to do is, once you have learned about TMS and you understand it, and once you have gone through the assessments to determine that, yes, my symptoms are coming from TMS, stop using the medical label. Because I talk to people who are saying, yeah, I believe my peripheral neuralgia is TMS. Okay, so then why are you still calling it peripheral neuralgia? Call it TMS, call it stress-induced pain, call it something else besides the medical label. The reason for that is these medical labels have authority, and they are scary, and they make things seem physical and more real than they are. Now, I'm not saying that the pain isn't real. It absolutely is. But the cause is not some nerve damage or nerve impingement or something like that. It's TMS, right? And there's virtually no end to the type of symptoms that TMS can and does create. So again, if you're walking around saying, I have sciatica, well, just say I've got TMS in the leg, right? Or I have this thing that doctors call sciatica, but it's really just TMS. And I don't even like that, because you're giving sciatica, this nerve thing, credibility and importance, and it's really not. So, which medical labels are you going to toss out? Please comment them below. What medical labels have you been carrying around and identifying as your problem for days, weeks, months, years, decades? Fibromyalgia. Get rid of that label and diagnosis. Fibromyalgia is TMS on steroids. It just means you've got them all over the place, We've got all sorts of medical diagnoses. So please, comment below. Which medical diagnoses are you going to commit to stop using? Because again, these medical diagnoses don't do you any good. And just a secondary topic here is, please stop talking to everybody you know about your pain. If people ask, say, I'm doing all right, thanks, how are you? And you change the subject. Spending an hour talking to a friend or a family member about your pain does nothing but reinforce that the pain is super important and reinforce the pain signals. We don't want to talk about it. We don't want to research it. Stop going to Wikipedia, WebMD, Dr. Google. Those sites are not helpful. They just give you more medical labels that you then have to research. And then, and I will also tell you that once you have understood TMS and done the assessments, please not only get rid of the medical labels, but get rid of the prognosis that your doctors have told you. I just spoke to a lady today who was telling her whose doctor was telling her that she has sensitized nervous system, central sensitization, and is basically saying, no, that's forever, you're stuck. That really infuriated me, and I was very clear in my comment back to this young lady that that is absolutely not true. If the brain can learn to become sensitized and learn to keep pain signals going even though there's no physical structural reason for it, then the brain can learn to let it go. And that's what we do all the time. That's what everybody who gets better from TMS does. We teach our brain that our body's fine and that the pain is not important and we're not freaked out and scared by it anymore, and the brain goes, oh, I don't need this anymore. We teach the brain that the distraction is not necessary, that we can handle our emotions. How do we do it? We feel our emotions. We soothe ourselves often. We reassure ourselves that our body's not broken. And so it infuriates me when these friggin' doctors who think they know it all are telling people, no, you've got this facial pain, you've got this, central sensitization, your nervous system is out of whack, you're going to be screwed up for life. How dare they say that this person is going to have a life sentence of pain? If you've ever been told that, tell these doctors, screw you, and never go to them again, because I don't care how important they are or if they're the greatest neurologist in the, East Coast, West Coast, in the country. I don't care. If any doctor ever tells you that you cannot get better and there is no cure and you're kind of screwed for life, it is time to either find a different doctor or double down on this TMS approach and say, does this make sense for me? Because this one lady said she'll have pain-free days, several days in a row, but then it'll come back. And he's like, oh, but that's how it works. No, that's proof that it's TMS, because if there was some real nerve structural problem, it wouldn't go away for a few days. So, got off into a tangent there because of that doctor that really pissed me off by the things he told this lady. But please, get rid of the medical diagnosis labels for your symptoms. Do the assessments. If you don't know where they are, go to Pain For You and download it. There's one there. You can also go to yourpaintest.com. Cool sounding bird. Yourpaintest.com. That'll forward you to danbuglio.com/paintest. Anyway, if you're on a Safari browser on an Apple or an iPhone, it may not work. I still got to figure that out. But yourpaintest.com. If that or the other self-assessments indicate TMS, throw away what the doctor told you. Your prognosis is that it's TMS and you can get better. And so please stop using the medical labels that the doctor or Wikipedia or WebMD or Dr. Google gave you. That's just an insurance code so that they can put it on the insurance forms. But again, those labels are scary, and they have authority, just like that doctor in his white lab coat. He's got authority, and look on his wall, he's got a medical degree or several of them up on his wall, and he's the expert. But man, if they ever tell you that you can't get better and the assessments say it's TMS, walk out of that office and don't go back, because all they're doing is creating more trauma, medical trauma. This is what I call medicalization. The fear of the symptoms gets escalated and built up and built up and built up with these authority figures telling you that you're not going to get better. And again, if you've done the assessments and it indicates TMS, those doctors are wrong. They don't know about TMS, and even if they do, they're discounting it because it doesn't involve their drugs, surgery, or structural physical manipulation or treatments, which basically means they can't earn an income, which means it doesn't fit their worldview, and they're not going to accept TMS as the cause of your problem. And if you don't want to use TMS, you don't even want to talk about Sarno, and if you happen to find yourself in a conversation with the doctor, ask him, can stress impact pain? Can it create pain? Because at that point, you know, they may be a little bit more open to stress-induced pain syndrome, stress-induced symptoms, certainly stress-induced stomach issues, stress-induced headaches, tension headaches, right? But generally, if you've done the TMS self-assessments, you can find them all listed at the top in the pinned post on the Pain For You private group. It says, unsure if you have TMS, and there's kind of a bulleted list of things you can do to verify if you do. But once you've done that, you know, disregard these labels. They're not useful. They're only scary. And the more you tell people that I've got this or this or this medical terminology, you're just repeating to yourself that you've got a problem. And some of these things are even classified as diseases. Fibromyalgia, holy cow. We don't know what causes it, and there is no cure. Why the heck would you ever want to accept that label as the cause of your problem? You have TMS in multiple locations combined with fatigue. That's essentially what fibromyalgia is. It's TMS plus fatigue, and fatigue is also emotionally and stress-induced as well. So please, if you're carrying around these labels, comment them down below. List what your labels are that you've been using to describe your pain, and your commitment to say, I'm going to call it TMS from now on, or I'm going to call it stress-induced pain, or I'm going to call it, you know, leg pain, or neck pain, or face pain, or whatever, back pain. Don't call it the medical label. Don't use the structural definition of, you know, whatever the doctors told you, because it just makes it more authoritative and scary. Hope that makes sense. So, love you guys and gals. Let me know what you think. And like I said, if you're carrying around a medical label, please comment below. Let me know what that is and that you're not going to use that anymore. Anyway, thanks. Love you guys.